Hello, this is Daniel from KC Allied Health, and in this video on taking care of your hands, we're talking about my little finger on the left hand. Now, this joint started to do this after I played the cello for about a year. You can see that joint in there starting to collapse. This eventually resulted in the joint, called the synovial joint, becoming irritated and resulting in some mild synovitis. The joint also started to become a little bit restricted, and I was having a hard time playing near the end of it because I couldn't actually push the strings down very strongly because that joint would just constantly buckle and collapse on me. Now, this problem has its roots in my wrist, not so much the finger. You see, my wrist flexing muscles are unusually weak for what I was doing, and as I was playing, my wrist was starting to tilt back more and more. As my wrist tilted back, a muscle called flexor digitorum profundus, which hooks up to my little finger, no longer had leverage on the joints. It couldn't pull the finger down very well, and so suddenly I was losing power and it was buckling out. Combined with that, my joint was already a little bit overflexible to begin with, and all of this was just adding together to create one big situation that I couldn't get out of. The first solution was just to rest it. Rest, wait for the inflammation to go down, and keep the finger as still as possible. Quite often in finger rehabilitation, especially if you've just had surgery, you wear a brace of some sort to make sure that the joint doesn't move too much. So I spent a lot of time with tape and making sure that that little finger didn't do too much. The next solution is addressing the predisposing and maintaining factors. Now, what this involved is I first had to start to strengthen my wrist flexors before I did anything with my little finger. My main wrist flexor that I was strengthening is a muscle called palmaris longus, and I can strengthen that just using a dumbbell and tilting my wrist up and down, as you can see here. But then I started to have to strengthen two very specific muscles. My finger would normally collapse while I was reaching with it off to the side, meaning I had to start strengthening a muscle called abductor digiti minimi, which is the muscle that pulls your little finger away from your hand, as well as flexor digitorum profundus, and I had to teach them both to fire off well together. To do this, I had to not only tilt my finger out to the side, but try to work on bending the little finger from the furthest possible joint, pulling in. Also was important to keep note of my wrist's position during that time, because if my wrist started to fall into old habits and tilt back, I would lose traction on that muscle and I'd be back at square one. This started with a lot of breaking it down into bite-sized chunks and strengthening individual muscles, and eventually led into some very complicated movements that took a lot of thinking to accomplish. Over time, the finger starts getting better and better at starting to pull down, and so you start applying it to more and more complicated things. I started with toenail clippers, learning to slowly clip down and slowly come back up again. When this becomes too easy, I take it to the actual subject, the cello, and start working on slowly pushing the little finger into the string and slowly letting it up again. I then go for a reach, my most dreaded position, where I'm trying to abduct my little finger and then push down, slowly up again. After that becomes too easy, then we stop doing it slowly, because not all notes are reached for slowly. I start working on tap, 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 back and forth, pushing down that string. After a while, you start then playing simple pieces that I don't have to think about too much as I play, so I can focus more on getting my neuromuscular control of my finger working. Some forms of self-care are going to require regular warm-ups and regular attention. Sometimes you can't just say goodbye to the problem forever, but you need to keep it in the back of your mind. And that's what it's become with my little finger. I can't say that it's completely better, but it is something that I'm learning to control. For those of you out there who have chronic pain and chronic problems, maybe they won't go away, but the idea is learn to control them through effort and education. If you have any questions or if you want to be educated on how to take care of any part of your body, you are more than welcome to contact the clinic, and any of the practitioners here are happy to discuss things with you. This is Daniel wishing you the best of health. Bye-bye.